It's a fact that a number of my healthcare workers were affected by this fifth wave. And it is because a number of these cases that we are testing, we test them in health facilities when they come to seek general treatment. And before they are confirmed to have COVID, they have been handled by workers. And in the course of doing that, ordinarily you expect that my healthcare workers get exposed and they get infected. As at last week, end of last week, I had over 200 healthcare workers infected in the entire county. But again, thank God, a number of them have also since recovered and resumed duty. In terms of geographical distribution, Alego, Usonga, and Game are now the leading. Incidentally, Game has shot up, and I'm seeing big numbers in Yala Township. I think that is because of the testing at Yala. But I'm also seeing big numbers in the last 1 week from West Game Ward. In Alego, Usonga, Siaya Township still leads, and that is, of course, also because of the large numbers that we test at Siaya County Referral Hospital. The other sub-counties are also showing relatively high numbers. I want to specifically mention Ugunja because in the last waves, Ugunja remained relatively stable. But in this fifth wave, Ugunja has also come up with large numbers, and that has something to do with the population of Ugunja town, the urban population of Ugunja town. The COVID situation in Siaya for the last 20 or so days has not been very good because we have seen a spike in our numbers effective around 14th December. We were reporting 0 to 1 positive cases from 1st up to around 14th. That from there we started reporting big numbers, averagely now over 100 cases in a day. This is not a good situation, but of course this can be explained because we now have the Omicron variant, which is a highly infectious variant in Kenya. It has been officially confirmed by the Ministry of Health that that is the dominant variant. So because of that, I want to make an appeal to the people of Siaya that we must not lower our guards. We must go back to the basics. The prevention measures remain the same. We must mask ourselves. And I've seen that a number of us no longer put on their masks. We must continue putting on our masks. We must observe social distance. We must continue washing our hands with running water and soap. All these basic preventive measures, majority of our population are not observing. But most importantly, I also want to appeal to our population that have not taken their vaccination that they should be vaccinated. I want to appreciate and thank the people of Siaya that during the drives that we were conducting on vaccination, a number of them got vaccinated, and as a matter of fact, we even surpassed the target that the Ministry of Health gave us by the 31st of December. We, as a county, we were given a target of 115,000 vaccinated people, first dose, and we achieved 121,000. And I want to urge that we continue getting vaccinated because it has been scientifically proven that those who are vaccinated, even if they are attacked by COVID, the severity is lower. A number of them are not hospitalized. But I want to appeal to us that we continue taking these measures. Let us avoid crowds. And if we must go to public places, let us be masked and let us observe those requirements.